What an amazing number of talks that we've heard. You know, I, for one, don't want to be living forever. I don't know about yourselves. But I'm really excited to be here talking to you, and thank you, Dr. Ahmed and Webbit, for having us, and obviously to you yourselves to come and listen to me about how we're democratizing communication in healthcare. I've been really privileged in the fact that, you know, being brought up in the NHS, my dad was a doctor, and I got to experience the NHS from his angle as a patient myself. Then I went and trained as a clinician as well, and practiced in the NHS for 5 years. And we also own and operate nursing homes. So I understood all the realms of delivering care in the NHS and social care system. But I also experienced it in a third world country. So I trained as a doctor in India and experienced how developing nations are, what different challenges they have, what they do well, what they don't. And I also did an elective in the USA, in the healthcare system there. And what I saw was that all of it, they all had communication challenges. And if we don't have the right information to the right person at the right time, it all breaks down. But exactly how important is it? What percentage of all medical errors do you feel cite poor team communication as a primary cause? Any ideas from the audience? Any thoughts, Dr. Ahmed? Why don't you have a go? 90%. 90%, okay, that's a bit too high, but it's 21%. Now let's talk about errors that might cause potentially moderate or severe harm. Moderate harm is defined as anything needing an increase in moderate treatment or moderate surgical intervention, or indeed a transfer of care to a tertiary centre. How many of those do you think we have in the UK? It's 61 million potential moderate harms due to errors. And severe, which is leading to death or morbidity and significant harm, 4.8 million events a year that occur in the NHS. As a clinician, I thought it's just my pain point, you know, communication and being not able to communicate with the right person at the right time. But this Band 6 nurse in the NHS hospital said she spends 2.5 hours of her working shift, so that's 12 hours. That's 25%, 20% of her shift, just trying to look for the right person to call, to page, or to actually go out on foot and try to find them. Sorry, let's try and move this on. That with the backdrop of the workforce crisis that we've got in the NHS at the moment. So we're 100,000 staff short as it stands. To put that into perspective, that's 1 in 10 posts in the NHS that are unfilled. Out of that, 40,000 nurses short, and that's going to be expedited by the time we have Brexit. Sorry to mention the B word. And the NHS has now declared this as a national emergency, quite rightly. Put this in perspective in the global context now. So we are going to be short of almost 13 million workforce in healthcare by 2030, as by the World Health Organization. The annual funding shortage in the NHS, that stands at a staggering £20 billion by 2020. So we're a year and a half away from that point. That's 15% of the entire budget of the healthcare system in the UK as it currently stands. To give you a bit of a background about pages, I don't know how many of you are au fait with them. You've probably long gone and not interacted with them at all. How many of you are au fait and understand what they are? Any of you use them, other than Vishal, obviously? Okay, so not many. So they're a one-way communication tool. So I'm a doctor on a ward, and Professor Shafi Ahmed, as my consultant, wants to reach out to me. He would go try and find a landline and drop in my 4 digits into that landline, hoping that I get the message. I'm on the other end whilst I'm having a consultation with my patient. Whilst I'm having that consultation, I get this beep on my pager. Do I go and leave that consultation, or do I not? I don't know who the message is from, I don't know how urgent it is, and I don't know which area they're in. But let's say I continue my consultation for the next 3 minutes, and then go and try and find a landline phone to communicate back with from that number. Professor Ahmed, being a really busy surgeon, he goes back into theatre, and I can't get a hold of him. And neither do I know who contacted me and for what reason. You can start to see where you start to play a lot of phone tennis at that point. Quick history of pagers. Initially seen in 1921 and used in healthcare in 1950 in New York, and became widely adopted across the NHS by 1952. The first smartphone came out in approximately 1992, and of course we've seen consumers really adopt instant communication solutions like WhatsApp, 2011. How many calls internally do we feel that we have in the NHS hospitals annually? It's a staggering 1 billion calls internally in just the hospitals. Out of that, despite having an online directory and, sorry about this, despite having an online directory and the numbers being printed out for people, there we go. Despite having an online directory and the numbers printed out on the wards for people, 23% of those internal phone calls are just to find the right number for someone. That's 230 million phone calls internally within the NHS hospitals just to find the right number. How many of these numbers are completely invalid, or people have just moved on, or pages been deprecated? 7 to 10%. 100 million wasted phone calls and people's time. How many calls went unanswered? 32%. And this is a challenge with synchronous communication. And of course, what I mean by synchronous is if you're on a telephone line, you've got to be on the telephone line with another person at the other end of it, and that's synchronous communication. So we're trying to overcome the outdated technologies with an iOS, Android-based communication solution, of course catered for the healthcare world. I won't go too much into the product, but just to show you where it needs to add value in healthcare and what the biggest challenges are is, in the directory, we don't typically know who's working on a particular day in a particular shift. So you need to be able to contact your surgical consultant on call for surgery, but you don't know exactly who it is. So I can't type Shafi Ahmed in there. Well, I can, but I don't know if it's Shafi. But I can type it into Medic Bleep to say, on call, surgical consultant, and up pops who it is. And to keep that intact, what we do is do a role transfer. So if I'm doing a role transfer to Shafi Ahmed, I would come in, open up my Medic Bleep, and he, whether virtual world or real world, I don't know where he exists these days, to be honest, but he would come in and scan it into his Medic Bleep, and away he would go with that role, and that's assigned to him thereon. Sorry. So technology is useless without understanding the benefits that it might bring. So on your left over here, you see the current process with pages and switchboard to do a discharge from a ward in a hospital. It's currently 27 steps with 5 wait periods. With Medic Bleep, with instant communication solution, because you don't have to be synchronous, one-way, one-to-one communication, that goes down to 13 steps and 1 wait period. I'm a doctor by background and a scientist, so I wanted to have a clinical robustness behind it. I wouldn't go out and prescribe a drug to my patient without understanding its impact and its efficacy and its side effects even. So what we did was a time and motion study where doctors were followed and nurses were followed, and timestamps done. Every single shift, we showed that every single nurse could save 21 minutes, and every junior doctor could save 48 minutes every single shift. And that was published in the Journal of Digital Health in a peer review paper. That was then picked up by all the national papers, if the clicker will move on. Sorry guys, just struggling with the AV. Picked up by the BBC, and the NHS was told to ditch its pagers over the next 3 years. So by 2021, we are not meant to have pagers anymore. We are the biggest users of pagers in the world at the moment, with 100,000 of them. But I hear the US is quite a fan as well. Sorry, are the batteries intact in this? So how many full-time nurses' time can be freed up using such a solution? If we remember the backdrop and we're 40,000 nurses short, if such a solution is rolled out through the NHS, that would free up and cover up the gap of 11,000 of them. That's 25% of that gap in workforce that we could help cover up. And efficiency savings, so you remember that we had a £20 billion shortage in the NHS in the next year and a half? We could help cover up 700 million in efficiency savings by just deploying a really simple and effective modern-day communication solution. Thank you.